similarities between lung and heart examination. But if it is heart, cardiovascular, the major focus is on the heart. Lung auscultation would be a bonus extra to that. If it is lung examination, it's mainly lung, heart will be add on to this, right? So basically it depends on the patient's vitals and chief complaint. The patient has chest pain, no actually flu-like symptoms recently, the patient doesn't have any fever, the patient has basically slightly high blood pressure, the patient is tachycardic, and the patient had chest pain for the last 45 minutes, brought in by the paramedics to your emergency department. In the next 8 minutes, take a focused, do a proper physical examination on the patient. Okay, so please speak loudly.
Okay,
So
but
3, 2, 1.
I don't know the techniques,
Let's
but
go.
anyhow, okay, I'll improvise them.
Loud.
Okay. Good morning. My name is Dr. Asma, and I am your physician for today. Could you please confirm your name and age for me?
Loud.
Martha, 45.
45.
Asma, 45.
Okay, Martha.
Martha, 45.
Are you in pain or you're fine?
Yes.
Okay. Can you lie down or you feel pain?
No, I can lie, it's fine.
Which position is more comfortable for you, lying
Okay.
down or sitting, right? So you're checking the patient's comfort, right? Are you in pain right now? Can you bear with me for the next couple of minutes that I finish my physical examination? All of these things are showing your empathy for the patient, right? So the same way that in your history taking, you were saying some empathetic expressions, the same thing in your physical examination. Are you in pain right now? Are you able to tolerate it for a couple of minutes till I finish my physical examination? That is showing empathy. Which position is more comfortable for you? Lying down or sitting? So all these things, right, are showing empathy. It may ask you to sit. Do you need any help for sitting, right? For sitting, do you want me to help you? All these things are showing empathy for the patient. Mm-hmm.
Okay, I would like to know the vitals of the patient. If there is any change in the patient's vitals?
The patient's vitals are the same. Just check the pulses. There might be some change in the pulses. I'm trying to make it easier for her. Otherwise, I would check the blood pressure as well.
Can I check your pulses in your hand? Is that okay with you?
I want to check your pulses.
I want to check your pulses. Is that okay with you? Okay. Are you lying comfortable? You are in any pain?
Yeah, I'm fine.
You're fine. Perfect.
The patient is saying she's fine.
Okay. I'll check the pulse. We will check the regularity of the pulse and the pulse if it is equal on the both sides. And
Pulses are regular. The patient pulse is around 70 per minute, 72 per minute. Pulses are being palpated regularly, symmetrically. It seems it's normal.
It seems like normal with little tachycardia. Okay.
72 is actually not tachycardia.
Yeah.
62 is normal.
Okay, Martha, I need to untie your gown, if that's possible. Do you need any help with that? I need only the chest area because I will examine only this part.
Am I supposed to raise it? Okay.
Do you need help? Would you like me to?
To untie it?
Yeah, untie just from the back. Do you need any help? She can help you.
I can help you in untying your gown. Okay, so I'm exposing your chest.
This is the only area that I need. I will start with the inspection.
General inspection.
Yeah, general inspection. Martha,
All the examinations start with general inspection.
for me, the patient is lying in pain, not comfortably on the bed. Martha, can you take off your glasses because I want to check your eyes? Could you please roll your eyes up for me? I'm checking for any pallor or jaundice.
You want to sit down?
Can you open your mouth, please? Bring your tongue out. Okay, I'm checking for the hydration of the patient, if there is any ulcers or there is any problem in the mucous membrane. Martha, I'm going to auscultate your chest. Please let me know. Is that okay for you? It doesn't feel like cold or it's fine?
You can rest on that. You can rest on
They
that.
cannot hear her.
I'm going to check the apex first. Okay. So I'm checking the apex of the heart for any murmurs and checking also for if there is.
In your observation, you can check for displaced actually PMI, point of maximal impulse.
Okay, but this is by palpation, right? By palpation, I check the muscle, right?
That's fine.
Then I will auscultate the S1, auscultate the pulmonary area and the aortic area for any murmurs or also for S1 and S2
M,
sounds.
M, nipple area, come to the sternal border T,
Okay.
come higher P, going to the right side A.
A.
M, T, P, A. All physicians take money. All politicians. All,
Politicians,
all-
not physicians.
all physicians or all politicians take
Make
money. Aortic, pulmonic, tricuspid, nipple area is fifth intercostal space, mitral area. So I am looking for any murmur, any abnormal sound. There is no murmur. Continue.
My next thing is I will go to the auscultation. Sorry, for palpation. I will palpate for the.
I want to feel. I want to feel your chest. I'm
Okay,
checking for the
I'm
apex.
going to feel your chest. Okay, is my hand is good?
Fantastic.
Okay.
Is my hand cold? You're fine. Okay, the patient is fine.
Okay,
Mhm.
then there is a displacement of the apex.
I am looking for any displacement of the PMI, point of maximal impulse.
It is in the fifth middle. In the
Fifth
fifth middle.
intercostal
Yeah,
space.
clavicular space. Yeah, in the mid clavicular line. So it is normal. No displacement. Then I would like to auscultate the back of the. Can you sit for me, Martha? Or you have to
Are you done with the palpation? Lie down. Are you done with the palpation?
I can't remember.
Why? You actually listen to my heart. What is next? I am using my hand. I am looking for any thrill. I am actually checking for the heave of the right ventricle. Check to use your fingers.
Okay.
Use your fingers for the thrill. Palpable murmur. Use this area of the hand, right? This area of the hand for heave of the right ventricle, right? Right
Okay.
ventricular heave.
Okay, so I feel it in here and here and here.
Yeah, in the same areas.
And then here.
Uh-huh.
Here and here.
It's mainly in the sternal border for the right ventricular heave. It's mainly for all the auscultation areas that you auscultated. You can use your fingers for any palpable murmur, thrill. Mm-hmm.
So no thrills. Then do we do percussion on this? Or?
Percussion? Why not? Check for percussion.
So I'm going to tap your chest. Okay. At any time you feel pain or you can't bear with me, just let me know. I will stop the examination. Okay.
In actually percussion of the chest, just remember, do not percuss on the ribs because you will not hear anything, right? Percuss in between the ribs, right? I'm hearing the normal resonance of the chest, right? Even if you're not, a lot of doctors are not, I have seen both. I have seen fantastic doctors with percussion, I have seen terrible doctors with percussion. So I know percussion is a little bit tricky, and it's, if you're not so good, practice on it a little bit, but at least do not percuss on the ribs because you will not hear anything, right? If you're not percussing on the ribs, you will percuss a sound of kind of the resonance sound in the chest. But you can actually, even if just do not percuss on the ribs, that's it. I could hear the one at the top, so that was good. Okay, good. Okay, it seems the percussion is normal. If most of your patients will not have anything really positive, right? So 1-2 areas of percussion should be fine usually. You don't need to percuss my whole chest all the way down.